Okay, welcome everyone to the Innovators Mindset. I have Vic Moharir here from ScribeLink. Vic, thanks for doing this. Appreciate it.
It's my pleasure to be here, Vic.
Looks like
And
yeah, it's a beautiful day where you are. You have a much nicer setting than my rainy city here.
that's right. Yeah, it's San Jose. Love the city, and a pleasure and an honor to be part of your wonderful organization and all the support you've given us through Jumpstart Foundry. So look forward to more of the same in the future.
Yeah, yeah, excellent. Well, so let's dive into what you have seen. This show's about innovators seeing a challenge and then jumping in to address it. What did you see out in the health marketplace, and what are you working on?
Sure. So, as many of you may know, my background is emergency medicine with biomedical informatics. So, two major challenges I saw in healthcare. Number one is the amount of time that physicians are spending on electronic health records and at the computer. So, this is taking away their focus from the patient. In addition, it's causing physician burnout because they're spending hours doing data entry. And the second thing that we've noticed is that family members can't always make it to a doctor's appointment with the patient. This is especially true when the patient has a chronic medical condition and needs multiple appointments. And in the days of COVID now, it's more important that family members perhaps not be in the room at the same time as the patient to cut back on the risk of infection. So we saw those as our two main challenges, and that's what we wanted to address through ScribeLink.
So talk to me about how you approached it. It's great to get the doctor with the patient and not data entering, stats all day for hours. How do you approach that where you need high fidelity, high quality, as well as convenience?
Right. So that was a real challenge. So in terms of what we did is we wanted the physician to be able to simply have a conversation with a patient. And the way you do that is you get someone else to do the data entry for them. Several people are trying to address the issue, but we see problems with the current approaches, whether they be technological challenges or trying to rely on artificial intelligence, which simply is not there yet and probably won't be there for quite a while. So our approach was to create an audio-video interface from the point of care. So using that audio-video interface, then that could go out to several parties. For example, it could go to a scribe sitting at a remote location doing the data entry. And then the other thing that it could do is it could go out to family members. So family members that perhaps are at work and can't get the time off from work. Yeah. It could go to consulting physicians. So what you have then is you have the physician focusing on the patient, putting their attention towards the patient, and then you have other people involved. And so this really improves patient care. It makes the doctors happy. The patients are happy because one of the things that we go to the doctor for is certainly we want the correct diagnosis and we want expert opinion. But we also want to be listened to. We want to feel like somebody's paid attention to us and our problem. And that gives us the confidence that when the physician does make a recommendation, that they've done so based on listening to us and paying attention to us.
Yeah. Yeah. So it's interesting. You're sort of opening up a window or a communication channel right to the doc's office or the clinic. Exactly. Or someone to support them, key in data or look up something or file things in the EMR correctly, but also family members. I didn't really consider the family member thing.
Yeah.
So exactly. It gives sort of this hybrid solution maybe where it's much more effective use of the doc's time, but you still get all the proper data entry and coding and things done that need to be done for insurance and for other stuff.
Exactly, and you actually get a better coding and better data entry and a more thorough note. Right now, oftentimes what we do is, as physicians, when we get backed up, we don't always have a time to do the note right away. So when your shift is over, all of a sudden you have 12, 15 charts to catch up on. And there's just absolutely no way you're going to remember the full details on every chart.
Right.
You're going to leave out things in the emergency environment. You may leave out perhaps a small procedure, perhaps putting on a splint. You forget to document that, and that leaves money off. So we do want a thorough documentation, and the best way to do that is to do so in real time.
Yeah, right. Okay, so has this been used ever? Do you have anything up and live? Talk about where you are in the process of getting it out there.
We do. We have a minimum viable product that has gone to a couple of beta sites, and the physicians that are using us absolutely love us. So the case study that we present is a psychiatry group. One of the doctors went from seeing about 8 patients a day up to 16.
Wow,
the other
so that's double. So and that hits his or her earnings too, I would think.
Absolutely. And not just that, but their job satisfaction went to the point of 1 out of 10, to where they were ready to quit medicine, up to a 10. They're happy again. And obviously they serve a valuable need for the community. And then the other 2 physicians have increased their volume by about 25%. But even more important, or just as important as the volume, is that they were spending about 8 hours every weekend catching up on charts, and they are no longer doing that. So they're incredibly happy with being in medicine again. So it does provide a valuable service to our clients.
Okay. So talk about where you see this going. Like, do you think it will sort of help all different specialties? Are there certain ones where it fits better? What's your view of the future?
So every doctor has to document. So no matter where they are in the developed, and this isn't just a problem with the United States, it's really a problem with the developed world, where all of them have moved towards electronic health records. We've talked to people from Japan, we've talked to people from Canada, the UK, and they all, I was a bit surprised, they all have the same problem. They're all like, all of our doctors are spending time on the EHR, and almost every single physician does have to document. So we do view all of the specialties as potential clients, and there's no reason why this can't expand to a broad market.
Okay, well, it's exciting. I mean, I really like the idea of solving a problem with what is available technically today and meeting the need, as opposed to some, futuristic, let's have a voice interpretation of everything, because this is medical records, and we have to be really cautious that we get the right data in. It's one thing for me to ask, Siri or Amazon what the weather's like out, but it's different when you have lab results and medications and things.
Right. And even with lab results and medication, that presents less of a challenge. The biggest challenge in artificial intelligence and medical documentation is getting the patient history. When you come in and the patient tells you what's wrong, and the person goes on for about 5-10 minutes about how they had a back operation several years ago, then they finally get to the point, oh yeah, and because my back twinged a little bit, I twisted my ankle, and now my knee gave out. So what humans can do and computers cannot is make a value judgment, what's important, what's not important. Many people that we talk to when we started doing this are like, well, AI is going to do this. After all, cars can drive themselves. And my response is, but you need to put a caveat there. You need to put down, cars can drive themselves under certain circumstances. So if you're on a freeway with very little traffic around and everything, the car may do fine. But the moment you get them into a parking lot with people coming and going in there, backing out, the complexity is simply not there in AI for them to make a value judgment. And the same thing happens.
Well, and what's interesting about ScribeLink is that it's an interesting framework where as the AI systems get better, machine learning gets better, it could do more and more, and humans could do less in a very natural, the doc doesn't have to worry about it, the patient doesn't have to worry about it. It just is, It just works.
Absolutely. And certainly having a human there, and coupled with an AI, that's how you train the AI system. So it's going to take a long time, but using something as ScribeLink where you have the AI as an adjunct and it keeps getting better over time, that will be there. We're still a ways away, but you're absolutely right in that you could couple the two for training purposes.
Yeah.
So
Great. Well, thanks for talking me through it. If some people want to learn more, is there a website they can go to and learn more about? What's your website, or where do they find more about?
Absolutely. ScribeLink.com, ScribeLink.com. It also has our contact information, a brief explainer video of how our technology works. Definitely welcome any questions or comments that somebody may have.
Okay, great. Well, Vic, thanks for talking me through it. It's exciting stuff. Hopefully when I go to the doctor next, they'll be using it for me.
Thank you. Thank you so much.